Nigeria has pledged to eliminate hepatitis by 2021. The West African nation is among 11 countries that carry 50% of the global burden of viral hepatitis, yet access to testing and treatment remains low. Hepatitis affects the liver, leading to cirrhosis and liver cancer, which is usually fatal. CGTN's Kelechi Emekalam has more.
A mandatory hepatitis B vaccination in Abuja Referral Hospital. An estimated 26 million Nigerians are infected with hepatitis B and C. Health officials here think the figure could be much higher if mandatory tests are carried out. The government is now encouraging early testing for everyone, so those infected are enrolled on a treatment program, while all those who test negative are vaccinated. The target is to meet the global goal to stop further transmission of the disease by 2021.
Almost every baby that is born in a hospital setting gets to get the vaccine for free. Okay? But for the adults, the response is not as encouraging. Okay? You screen people and ask them to come for vaccines, perhaps because they have to pay for it and they do not have any illnesses. So they are not keen to come up. We do get one or two people, but the response to vaccination amongst adults is actually quite poor.
And that being the main headache for health officials here. Most Nigerian adults have insufficient information to take hepatitis seriously. Yet, most infected are those between 21 and 40.
The knowledge about viral hepatitis remains low, even though it is a leading cause of death. As a result, most Nigerians living with viral hepatitis B or C are undiagnosed, increasing the likelihood of transmission to others. It also places the individual at the greater risk of severe, even fatal health complications, such as liver cirrhosis and liver cancer.
Part of the early testing to be carried out countrywide will also act as an important survey to ascertain the true burden of hepatitis B and C in Nigeria. The outcome of that survey will determine the strategy and scale of intervention by the Ministry of Health. The question is, how can you convince over 100 million adults to take a test they've avoided their entire life in such a short period? Kelechi, Emekalam, CGTN Abuja, Nigeria.